All right, good morning to all of our media partners. We appreciate you joining us today. Today is the COVID briefing for Thursday, June 10th, 2021. My name is Joe Doherty. I'm with the Utah Department of Public Safety and the state's COVID-19 response. Today we have two speakers for you today. Lieutenant Governor Henderson will be here, as well as Dr. Michelle Hoffman from the Utah Department of Health. We are excusing Governor Cox today, who has another engagement. So, Lieutenant Governor Henderson.
Thank you very much, Joe. Good morning, everyone. It's a pleasure to be here. Now, as Joe mentioned, the governor's not here today. He's doing something else right now, something important, of course, and so we excuse him. But Michelle, Dr. Hoffman, and I are happy to be here. Our state is not immune from challenges, as we all are very much aware, both natural and man-made. And the governor and I are very committed to facing these challenges with tact, with wisdom, and with compassion. Before we get started on our COVID information, I want to address three topics. Two of them are natural, one is man-made. The fact that we live in a desert is apparent this year, more apparent than ever, as we face one of the worst droughts in our state's history. I'm hearing it's either the worst drought since 1956 or the worst drought ever in our state's history. So it's easy for people to tune out this drought message because we seem to always we're in a desert, we're always dry, we always seem to be experiencing some sort of a drought. But this drought that we are experiencing this year is extremely severe. And it's going to require us to communicate with you more about it. It's going to require every single one of us to take actions and do our part to mitigate its terrible effects. And this is one of those years that we are going to have to really be concerned about drought. Thank goodness we have reservoirs. Without them, we would be in a much worse situation this year. But we didn't receive enough snowfall over the winter to fill our reservoirs. This is the time for everyone to do their part to conserve water. Use it for what you need and only what you need. As state facilities, we're limiting the time that sprinklers are on. You can do this too with your own lawns, and you can learn more about how to conserve water at water.utah.gov. The governor the other day at the press conference said, make yellow lawns great again. I say, yellow is the new green when it comes to lawns this year. So embrace yellow lawns, everyone, and do your part. The other natural issue I want to talk about is fire, and this goes hand in hand with our drought. Our wildfire season is already in full swing, much, much earlier than normal. With the dry conditions throughout our state, we've got record high temperatures in the coming week. We're imploring all fellow Utahns to be extra cautious when recreating outdoors and when towing your vehicles. Please learn more about how to prevent fires at utahfireinfo.gov. Now, the last thing I want to talk to you about before we dive into COVID information is a man-made issue. The recent news about the vandalism on the Filipino food truck in Layton this week is very troubling. Our small business owners should feel safe to operate and live in our communities. We applaud local efforts to bring vandals to justice and efforts by community members to rally around the food truck owners. But this incident also highlights that racism can be found anywhere. And it doesn't have to be this way, and it shouldn't be this way. We condemn all acts of discrimination, vandalism, or unkindness based on race. We stand with our Asian American and Pacific Islander communities. We support them, we love them, and we call on all Utahns to look for ways to stand together and to support one another. Now on to COVID. Looking back into late March, when everyone age 16 and older became eligible to receive the COVID-19 vaccine, there have been 22,767 total COVID-19 cases identified. So that's since mid-March or late March. 99.6% of them have been in unvaccinated people. There have been 1,208 people hospitalized since then. 95% of them were unvaccinated. And there have been 64 deaths. 97%, 62 out of the 64, were unvaccinated. Should be very obvious to everyone. The vaccines are working to prevent most cases, hospitalizations, and deaths. Now, even though the pace of vaccinations has slowed to the point that we really aren't ordering new doses right now from the federal government, we continue to make progress, although it's not as quick as we would like it to be. We've now administered nearly 2.7 million total doses of vaccine. Almost 59% of all eligible people ages 12 and up in Utah have gotten at least one dose. And 89% of people 65 and older have also received at least one dose. 80% of this group is fully vaccinated, which is just incredible. In Utah, we're proud of the parents who are getting their adolescents vaccinated. Last time we met, we reported that 14.2% of 12 to 15-year-olds have received their first dose. And as of yesterday, we now have 20.1%, or more than 43,000 kids in this age group with their first dose, which is really great progress, but we can do better. We want to reiterate the things that can happen when people get vaccinated. Just this week, we've all been watching the Jazz, and we've got almost full capacity at Vivint Smart Home Arena now. And it's things like that and local gatherings that are going to be able to happen and occur with more frequency if we can all get vaccinated. Last week, just in this last week, we administered 16,929 doses of vaccine. Now, that's a big drop from what we've been used to. We need to administer at least around 51,000 doses a week to really get to the goal that we want to get to by the beginning of July. So there's a major push right now to get as many people vaccinated as possible, and really too many people are waiting to get vaccinated. And that can potentially let variants take hold in the population and start this pandemic all over again. We do not want to go back to where we were last year. We do not want to be in trouble again this fall. And if we want to avoid that, people need to get vaccinated. And it's going to take everybody's efforts, even those who have already been vaccinated, to make sure that this happens. And if you haven't been vaccinated yet, please, please make the effort to get your vaccine. All you need to do is stay an extra 20 minutes at Walmart when you go grocery shopping, or at your local pharmacy or Walgreens or wherever you are. All those pharmacies have vaccine doses available, and it just takes a few minutes to stay and get a dose of vaccine. And we respectfully ask that you do that. And I want to reiterate too, the vaccines do not alter your DNA. They do not impact fertility. They do not give you COVID, and you don't have to take my word for it. Please talk to your doctor if you have any questions about the vaccine. We have a goal of vaccinating 70% of adults with at least one dose by July 4th, and we're going to need everyone's help to get there. So we are going to be asking businesses and community organizations to lead by example, to encourage your employees, and to make it easy for them to access vaccinations. COVID-19 vaccines are free. They're widely available at hundreds of vaccine operations around the state, including walk-in and after-hours appointments. Now, we want businesses and community groups and religious organizations to consider hosting pop-up vaccination sites at your place of business, especially before July 4th, and perhaps even invite other businesses in your community to join. These pop-up clinics are free of charge, and they're easy to request at coronavirus.utah.gov. The link is right on the front page of that website. There's no minimum number of employees, so even if you only have a handful of employees, we encourage you to request a pop-up clinic. It's time for businesses to start offering incentives to their employees, like paid time off to get the vaccination or recover from side effects, Or even we've heard of some businesses offering cash incentives and gift cards. We encourage businesses to be bold and to be generous when it comes to offering these incentives to their employees to help us make it to that mark of 70% by July 4th. You can see a list of what companies are doing to encourage vaccinations and maybe get some ideas for your own business at vaccines.gov/incentives. We also would love you to connect with your local Chamber of Commerce to see how you can participate in a statewide public awareness campaign, and share coronavirus.utah.gov for the most reliable vaccine information, which provides important vaccine facts from our trusted resources. And now we're happy to hear from Dr. Michelle Hoffman.
Good morning, and thank you, Lieutenant Governor. First, we'll start with our data update. Our 7-day rolling average for positive cases was 276 per day, which is up from 1 week ago at 208 per day. Our rolling 7-day average percent positivity person over person is 6.6%, which is the same as 1 week ago. Our rolling 7-day average percent positivity test over test is 4.3%, again, up slightly from 1 week ago. So we are experiencing a slight increase in cases right now. It's unclear if it's related to the Memorial Day weekend, but it's certainly possible. We've certainly had that experience in the past, far worse than we did this Memorial Day weekend. We also know that fewer people are wearing masks and that we have many Utahns still unvaccinated. We know that both of these prevent COVID-19 cases and that we need to be masking until we're vaccinated. There does not seem to be any single outbreak or geographic area that's driving these cases. We are keeping a very close eye on our data, and we're prepared to respond with increases in testing resources and vaccination resources. It's really a reminder that we're not out of the woods. COVID is still in our communities. It's still spreading. Our hospitalizations have been flat for more than 2 months now, and we have a way to almost eliminate hospitalizations. With some of our other public health measures going away, like masking, many people aren't wearing masks. People who are not vaccinated need to do their part and get vaccinated now. I wanted to spend some time today on a new data source that we're adding to our public dashboard, effective today. The source for the vaccine data that we've presented so far on our public dashboard is drawn from a system called USIS. Most vaccine providers in the state report to USIS all of the vaccines they administer on a daily basis. But not all providers report to USIS. This means that the vaccination data on our public dashboard slightly underrepresents the actual doses administered in our state. The biggest providers who don't report to USIS are the federal government agencies such as the Department of Defense and Veterans Affairs. These providers report their doses into a federal system called Tiberius. For the past few weeks and months, we've been working hard to learn more about these doses that aren't reported into our USIS system, but are reported into Tiberius. These Utah residents have done the right thing and gotten vaccinated, and they deserve to be represented in our state's data. And we also want to be transparent with all of the data that we have. Including them gives a more accurate picture of the number of people in Utah who have been vaccinated. So beginning today on the vaccines tab of our dashboard, we'll begin to separately report the numbers of doses from these federal agencies and reported into Tiberius separate from the USIS system. These data will be updated weekly. The bottom line on this change is that there will be an additional 28,271 people who have had at least one dose reported in Tiberius, but not in the USIS system. When added to the number of people with one dose reported through USIS, this small adjustment adds about 1% to the percent of our population who's 16 and older who have yet received a one dose of the vaccine. Every dose counts in our goal to get to 70% of 16 and older Utahns vaccinated by July 4th, and we're excited for this change. The last area I wanted to spend a little bit of time is around vaccinations for children. As the Lieutenant Governor mentioned, since opening vaccine eligibility to younger children 1 month ago, we've seen almost 43,000 children between the ages of 12 and 15 vaccinated with their first dose. We should celebrate this, but it's also a call to do more. Despite what many have heard or believe, kids get COVID-19. In fact, we've had nearly 77,000 children in Utah diagnosed with COVID-19 during the pandemic. Nearly 700 of these sick enough to be hospitalized, and 74 developed a rare serious condition called MIS-C that's related to COVID-19 and can lead to lifelong complications. In the past 6 weeks alone, nearly 1,400 children between the ages of 12 and 17 have been diagnosed with COVID-19, which represents 13% of our total cases. If you're a parent, now is the time to get your child vaccinated. If you have questions or feel uneasy, that's okay. It's understandable. Go to your doctor, talk to your doctor, get the information that you need to make an informed decision. If you're a pediatrician, I'm asking that you reach out to parents of your patients. They trust you with their kids' healthcare, and they need to hear from you on this subject. Some healthcare providers are already doing this, and we applaud those efforts. For others, I personally will be sending a toolkit with materials for all providers, pediatric and otherwise, so that you can have these conversations in every patient encounter. My ask is that once you have these materials, you pass them along to your patients and you continue to be their trusted resource for them. Thank you.
Thank you, Dr. Hoffman. We are happy to take any questions if there are any.
Is there a concern for a new surge after Memorial Day as more folks are going on mask?
Dr. Hoffman.
We have seen a small slight spike in cases, as was mentioned in the detailed numbers. However, this pales really in comparison to where we were last year. The important point about this is that we don't want to repeat the mistakes of the past. We've already been through all of this. We know we experienced surges after holidays. We know that we experienced a fall surge when we went back to school. We do not want to repeat these mistakes. That means that we need to mask and continue to mask until vaccination. Thank you.
Any other questions?
Good morning, Lieutenant Governor and Dr. Hoffman. Question is, as you mentioned, the rolling 7-day average is 276 today. That is higher than last week. It's actually the highest it's been in 3 weeks. Today's and yesterday's averages. Are you at all concerned that the state's messaging on this is that things have eased off because you've removed the United command, you've cut back on the briefings, you have on nothing personal, the Lieutenant Governor instead of the Governor running the briefing, restrictions lifted by the legislature and by the Governor. Is there concern that the message from the state is that things are back to normal even when they maybe should not be?
Well, thank you for the question. Our message has never been that things are back to normal. Our message is that we want things to be able to get back to normal. And we are better. We are doing better than we were. The purpose of all of the restrictions was to make sure that people who didn't have the tools necessary to keep themselves from becoming sick and from infecting others, that we're able to protect people. And now we have those tools available and we need people to use those tools. And so, we can't hold everybody's hand forever. We have to rely on people to be responsible for themselves and responsible for their families and their neighbors. And we're calling on them to continue to be responsible. Many, many Utahns have chosen to be responsible and we are very grateful for that. But people who haven't yet need to continue to be responsible. They need to get vaccinated. They need to wear masks. And that has been our message from the get-go. We don't ever want people to think that there is no end in sight to this, even if they do get vaccinated. That's not a good message either. So we are hopeful that people will choose to do what's right and to be responsible.
Is there a way to further incentivize vaccinations besides just asking nicely?
Yes, there are ways. And of course, one of the things that we're doing this week is calling on businesses. I believe the governor will be sending out a letter through the Chamber of Commerce, Salt Lake Chamber, to businesses asking them to do their part to provide these pop-up clinics to make it easy for their employees to get vaccinated. Not only make it easy, but provide incentives. The legislature kind of put a bit of a kibosh on the state providing any kind of incentives for people. And so that's something that we can't really do right now. We are talking with legislative leaders about that. We've seen those efforts work in other states, but even if we can't as a state provide those types of incentives, and if for some reason, I don't know, not getting sick with COVID isn't incentive enough, we ask businesses to provide those incentives to their employees.
Good morning, Lieutenant Governor Dr. Hoffman. Chris Reed, St. George News. Speaking with a couple of health officials, at least down here in the South, one of the comments I'm getting a lot is that this is entering a new phase now. They even have used not so much the words, it's no longer a pandemic, but this is going to be one of the 4 respiratory coronaviruses we deal with each fall and winter. Do you agree with that assessment? Can we say this is not as much a pandemic anymore? Is this something that at least the non-vaccinated people are going to live with, or is that not a correct assessment?
I think the Lieutenant Governor spoke about this really well. We have a choice to make as individuals to prevent a disease by getting vaccinated. We will have to normalize COVID-19 into the way we manage all other diseases. We're actually working right now on conversations around creating a disease plan, just like we have for any other infectious disease threat, so that we have a standard way to respond when we see cases, how we respond in outbreaks, how we manage quarantine, what other public health recommendations we make. COVID-19 has been a different entity for long enough, and it is going to have to be normalized into the way we manage our public health response. But every Utahn needs to understand that they have a choice to make, and that if they choose to be vaccinated, we can essentially nearly eliminate the risk of the severe complications that lead to hospitalization and death. And that's a choice that every Utahn has to make.
As a quick follow-up, Doctor, you mentioned this, and the Lieutenant Governor can address this, but you've mentioned that those who aren't vaccinated need to still mask. However, just to be honest, a lot of the people who aren't getting vaccinated were also anti-mask, would be those who would flaunt that and not wear masks in public, even during the worst of the pandemic. With that being the case, how can that be solved?
Again, it really is about those personal choices. In fact, we do have data that shows that people who are vaccinated are also the same people who are continuing to wear masks to protect others around them that have not had access to the vaccine. We're not going to be able to bring every single Utahn along in this journey. But for those who have been thinking about a vaccine, the time is now to get vaccinated.
Yes, good morning. This is Jacob Klopfenstein with KSL.com. I wanted to ask about the 70% goal by July 1st. Looking at the vaccine rates right now, I guess to me, it seems pretty unlikely that we'll meet that. So I guess I'm wondering what, in the event that we don't meet that goal, how is the state preparing to move forward after July 1st if we're still under 70%?
Well, and the goal, thank you very much for the question. And the goal is July 4th. And it's somewhat an arbitrary goal, right? But we have to have something to work toward. So we are making the push. We can do better. We must do better. And if we don't hit that goal, we keep striving toward it until we do make it. Okay, thank you very much. Appreciate you attending and taking part in this today.